Well, here I am again with another successful story of a combined procedure. All on four and uppers, crowns on lowers. Yes, you can do it. It doesn't matter if it's a combined treatment, everything's all on four or everything's crowns. At the end, it's a complete makeover. Catherine, I'm so glad to have you here.
Thank you, Dr. Arzate.
Where are you from?
To be here. I'm from Oregon in the United States.
Oregon. Big hugs to Oregon. Here we are in sunny Cancun, and we love to have our patients to come and visit us. How many hours from Oregon to here?
About 7 total flying hours.
Okay. Well, and you flew 7 hours just to come see us?
I did.
Yeah.
I did. Yeah. I did a lot of research.
You did research?
I did a lot of research online, and really Cancun Cosmetic Dental had the best reviews for the most efficient price points.
Nice. And you saw lots of pictures of before and after?
I saw so many pictures, and yes, and
testimonials.
you have wonderful videos on YouTube as well. Yeah, I mean, this was my mouth, this was my body. This was really a big deal to me to look into fixing a serious decaying teeth and abscessed teeth situation I was dealing with, and which was scary and hard and sad and frustrating. So I did a lot of research. I reached out to some of your patients and emailed them and asked questions, and they had nothing but such positive things to say about coming here to have this work done that I made the leap to do it.
Wow. Yeah. So you did research, you talked to patients,
I did.
And then you decided to come and do that change that you wanted.
I did. I reached out to one of your patient representatives, Claudia, who immediately, you have on your website, you have kind of an instant talk to us, ask us questions.
Yeah.
I probably made her crazy. I must have asked 50 questions a day. She always had the right answers because, it's not something, if you haven't done this before, you haven't done it before. So you're starting from sort of being a baby at scratch. And so I had so many questions, and I always felt really comfortable with the answers I got. They were very direct. Nothing was hidden or, the cost might vary depending on such and such. It was this is what it's going to be. This is how we do it. This is how much of time we need. This is when we can get you in.
And that's when you decide to trip. Well, you booked your trip for 2 weeks, no?
I did, because I just wanted to make sure. I knew that I needed some work done on the bottom. I knew all my teeth had to be extracted on top. Yeah. So that was a given.
And she's very young, huh?
I'm 47, so it was too young for that. It was a medication and an illness issue that caused my teeth to just kind of crumble in my mouth, quite honestly. I spent a lot of money trying to save them, but it wasn't to be. So I wasn't sure exactly what I would need done on bottom until I got in to see you. So I wanted to make sure I just had just a little extra enough time if you needed me here longer for that. I didn't want to cut it short and try to cram it in too quickly.
Well, I'm so glad that you're sharing this video, because sometimes there are patients that they think that it's like something really fast. No, probably you can get lots of questions, lots of answers, and even a video. Or when you come here, you weren't planning to do the lowers, and then planning, but to do.
I was planning to do something, but I just didn't. I wasn't planning an all on 4, but I didn't realize I did 10 crowns. It's like, okay, well, it was important to me, not only aesthetically to have my upper and my lower teeth look nice together, but I also wanted them to be healthy. And what we did helps me to move forward with a healthy mouth, and that's really important.
And look at that smile. You look amazing.
Thank you.
Amazing.
I feel great. I'm really proud.
Once we placed that all on 4 on uppers, and obviously the crown, we put zirconium crown on lowers. And what was the difference about biting, chewing, confidence? Were you able to bite like something that you weren't able to bite before?
I had 9 teeth left in the upper part of my mouth, and I had what they call a flipper with a couple of teeth, but with so many problems. I had, and a lot of people didn't realize it because they didn't look horrible from the front. They certainly weren't as beautiful as they were when I was young and they were healthy. However, there was so much decay and chipping and problems on the back that I was to the point I wasn't chewing on certain sides of my, on one side of my mouth. I wasn't chewing at all. If anything was more than soft food style. And I wasn't biting down into anything with my front teeth because I was afraid that the front right tooth and the one next to it would just break off in my mouth. So, you know, I'm not a little girl. I like my food, and it has not been a fun time for me to have to monitor what I was eating, how I was eating. Is that, you know, oh, is that steak something I have to cut into tiny pieces and only chew on this side of my mouth when I eat it? Or, you know, now I feel like I can just bite into anything. I don't have any more infection, which makes my whole body feel better.
Yes.
We don't realize when our mouth is not healthy, our body's not healthy.
Exactly.
You know, and I'm feeling better. It's amazing to me that this was able to be done in such a short amount of time. What people spend or tell you sometimes will take years and years to fix. It doesn't have to be that way.
What we did is that with IV sedation, what we do is that obviously we extract those teeth, we set the all on 4, remember, to tilt to straight, and on lowers we prepare for crowns in those 2 days. Not on the IV sedation, we only did the uppers, and then next day we did the crowns, and just with a couple of days we had this result, and
Yes.
and you look spectacular.
Thank you.
Were you able to bite something like hard once we placed them in?
Yes.
Yes. What was like something
Into an apple. I ate an apple,
nice?
and I ate some like tortilla chips with
Tortilla
chunky
chips.
salsa, and I didn't have to worry about.
Like the crunchy tortillas.
Right.
Nice. And what was the difference? I want to ask you. What's the difference between doing it here and back home? The price.
Well, I'm gonna be really honest with you. I'm in a fortunate financial situation, so my decision was not. Price was not my primary factor. It was. I mean, it's important. Who wants to throw away money? They don't.
No.
They shouldn't. I mean, you don't want to light $100 bills up for no reason. However, I went to actually online and started putting in, you know, denture
All-on-4.
alternatives, things like that. I didn't even know what all-on-4 was when I started.
I get it.
So I found a website called realself.com, and then I looked from there and found out, oh, there's all-on-6, there's all-on-4, there's snap-in dentures. So I started to drill down to what was important to me. And I actually rated my search by highest reviews by patients.
Yes.
And you came up.
Yeah.
So, you know, I mean, some people might look for their keyword search may be dental tourism, less
Yeah.
expensive options.
Yeah.
But my primary thing was, this is my mouth. I'm 47. I hope to live 47 more years.
Yes.
And I wanted something that was going to be pretty much a lifetime option for my teeth. And so that's when I started reading your patient reviews and discovering what people
And
had to
talking to
say.
patients.
Yeah, and talking to patients
That's
and reaching
important.
out. And and then I found your website through that, and so that's where I started talking to Claudia and getting answers to my questions. Because if you would have said all-on-4 to me 2 months ago, I would have said, what is that, a baseball game? Is that a sports term? I would have had no idea.
I
truly.
get it. No, well, I'm so happy that you found all those solutions and those answers, those solutions, and that you came to Cancun. What can you say about Cancun?
It was an answer to my prayers. Oh, Cancun's beautiful, and I've been here before, and I was excited to come back, so I felt comfortable coming here knowing, you know, I think people think somehow in their head, if they're going to go outside of the United States to have any kind of medical procedure done, that somehow they're going to be in an alley with chickens and goats or something. I mean, I don't know why, but that's what people think in their head. And it can't be farther from the truth. I mean, I have unfortunately spent a lot of time in dentist offices in the last few years attempting to save the teeth that couldn't be saved. And definitely about your office, it's so clean. You have the most modern, up-to-date dental tools,
The
processes,
staff,
procedures.
and everyone.
Your doctors are all wonderful and kind and competent. And I mean, from the moment I walked in here on May 23rd for my surgery, I felt very comfortable
I'm glad.
with the cleanliness of my surroundings.
Wow, I'm glad to be part of your solution that you were looking at, and that you came all the way. And we want to say hi to your husband. That he didn't came. He needs to come.
He has to work.
He has to work, but
Yeah.
next time he's gonna come.
Yes.
Because I know that you also went to Chichen Itza. You even had time for
did.
suntan. Look at her suntan. She looks amazing.
Thank
You
you.
went even to Chichen Itza, the ruins, the Mayan ruins.
We did.
2
It was
hours
wonderful.
from here. It was
Yeah.
a wonderful day
Spent the
also.
day there. Absolutely. I got lots of nice time at the pool. You know, I probably could have done a little more activities, but I honestly looked at this as
You
a
were
time
like-
to relax and take care of myself so I could recuperate well. And since I'd been here before, I really kind of enjoyed probably more pool and ocean and just sun time than
next
anything
year,
else.
you can come and see me next year, and we can check those all on for how they're doing those crowns.
Great.
Probably a cleaning or something like that, but yes, we can check that, and then you can bring your husband.
I look forward
and
to
now
it.
you can go see the cenotes and go to Xcaret and many
Yes,
places.
there's certain things I felt like I couldn't do without him. It wouldn't be fair. So yeah, I had to limit those.
I'm glad. Well, thank you for sharing. Thank you for telling someone out there, because this is the magic about the internet, that probably you're looking at us and seeing, wow, is there solutions? Even if you don't come with us, there are solutions. If you don't like your teeth, if you don't like the shape, the color, the size, there's always a solution. Now, dentistry has gone really advanced on techniques, procedures, and
It's
materials
amazing.
that you can find. My country, Mexico, it's a very poor country, but we are located just below the most important country of the world. So all the materials are imported from the States.
Yes.
Even a napkin, it's imported because we don't produce nothing.
Right.
So when they ask us, are the materials going to be wrong or whatever, we don't even produce them. And I don't use even Chinese materials or no. We have seen so many patients from the States and from Canada that we need to use the same materials they use back home.
Right.
Like the implants you have, the Nobel Biocare for all on 4. It's a German company that is located also in the States. So it's a worldwide language of if you go tomorrow to any country, they know what you have there.
Right.
Because it's like a code that they have.
And that's something I researched, because
Yeah.
Oregon's a long way from Cancun, and if I had, just a small issue at home, I wanted to know that I could go to an implant
Yes,
specialist
exactly.
in my state,
Exactly.
and they would look at what I had and
Yes.
say, oh, we can help you with, whatever.
you need.
It's just
Yeah.
something small. Yeah, I'm sure I'm not going to have any problems, because they feel wonderful, and they're so
They
strong
feel
in my
strong,
mouth.
no?
Oh my gosh.
Yeah, it's a
much stronger
platform.
than the teeth I had, trust me.
Nice, that's
Yeah.
good. Well, as I told you, we're playing gods, all of us, because we're putting teeth where there are no teeth.
Right.
So this is the first moment in human being in dentistry where we can do. Remember that bionic man, the $6 million with Steve Austin?
Yeah.
Well, we are in that era where you have something external working inside your body, and it's interacting inside the bone, the gum, and then in the external. So it's beautiful.
It's wonderful.
We're in an amazing, and it's the same material, titanium grade 5. It's the same material they use for hip replacements, and everything that is now on technology, it's applied also here in dentistry. So I'm proud and I'm glad to be working with all these materials, and I'm so happy to be doing this, and I really want to to thank you and appreciate that you're saying all this in this video and sharing a little bit, because it's very important if you're out there to know that what we're doing is doing it with love and doing the best we can always. And in Mexico we're doing amazing dentistry also, but just find someone that has lots of reviews, lots of testimonials, lots of photos. Photos are important.
Right.
But if you want to talk to patients, we have lots of patients that are also happy, and they will be happy to share.
Wonderful.
Thank you. Thanks, Catherine.
Thank you, Dr.
And,
Arzate. I appreciate it very much.
Thank you for trusting. You have friends here in Cancun. Also, Willie, thanks for your help. Thanks for your help also. And thanks everyone for watching. Big hugs to Oregon. And we have patients that they come from that area also, from Oregon and all that area. Big hugs from sunny Cancun. I'm Dr. Arzate. And thanks for giving us your likes in our social media. And here we are. Thank you. Bye.